I'm Dr.Usha Suresh. I'm a specialist gynecologist at Aster Medical Center, Dubai, Marina. Today I will be talking to you about gestational diabetes. What is gestational diabetes? Diabetes that occurs during pregnancy is known as gestational diabetes. It usually develops in the second half or later part of pregnancy. It happens because your body cannot produce enough insulin, the hormone involved in controlling blood glucose, to meet the extra demands made during pregnancy. How common is gestational diabetes? Gestational diabetes may affect 1 in 7 pregnant women. It is found more likely in women who have a high BMI, that is a BMI of 30 or more, if there is a prior history of gestational diabetes in an earlier pregnancy, if you have a family history of diabetes, if you have a previous history of giving birth to big babies, that is baby weighing 4.5 kg or 10 pounds or more, if you are South Asian, Afro-Caribbean, Chinese or Middle Eastern in origin. A woman who has the above mentioned risk factors will be screened for her blood glucose at the first antenatal visit. All pregnant women will be screened with an oral glucose tolerance test between 24 to 28 weeks of gestation. This involves an overnight fasting and a visit to the clinic where a fasting blood glucose will be collected. You will be given a glucose drink and blood samples will be drawn at 1, 2 and 3 hour period to see how your body copes up with the glucose drink. If you are diagnosed with gestational diabetes, you will be looked after by your obstetrician, a dietitian, a doctor specializing in diabetes and a nurse. You will be taught how to monitor your blood glucose levels and you will be given a sugar diary to keep. This will involve your checking the fasting blood glucose values, and the blood glucose should be checked 1 hour after or 2 hours after breakfast, lunch and dinner. The target values are as follows. Fasting blood glucose equal to or less than 95 milligram, 1 hour value equal to or less than 140 milligram, the 2 hour value equal to or less than 120 milligram. You will be given a diet plan and advised regular exercise like walking for 30 minutes after each meal. Most of the women diagnosed with gestational diabetes have a healthy pregnancy and deliver healthy babies. Some women may develop complications during pregnancy. The sugar may not be well controlled despite their best efforts and they may need medication or insulin injections. The risks to the mother include risk of developing preeclampsia, that is high blood pressure and developing proteins in the urine, higher rates of induction of labor and cesarean section rate. After pregnancy, the blood glucose may not revert back to normal and a small percentage of women may continue to have higher blood glucose after delivery and develop type 2 diabetes. The risks to the baby are as follows. The baby may have maybe a big baby, that is fetal macrosomia. Higher blood glucose levels in the mother lead to a higher blood glucose in the baby, leading to more insulin being produced. This makes the baby grow bigger and this may lead to complications during birth like shoulder dystocia. There may be higher needs for induction of labor and the baby is also prone for complications like being stillborn just before birth, or an early neonatal death. The babies are prone for hypoglycemia, that is, low blood glucose levels immediately after birth. They may need care in the neonatal intensive care unit. The babies are also prone for breathing difficulties and may develop respiratory distress syndrome. They may be developing jaundice and need to be monitored carefully. During pregnancy, the doctor will plan how the route and the mode of delivery and the timing of delivery depending on individual circumstances. During labor, the blood glucose will be monitored every hour. The baby will be monitored by continuous fetal monitoring. After delivery, the baby should be breastfed as soon as possible and every 2 to 3 hours to maintain a safe blood glucose level. All your medication will be stopped immediately after delivery as the sugar tends to revert back to normal. You will be monitored during your stay in the hospital, and during discharge you will be advised about a healthy diet plan, regular exercise, and you will be asked to come for a checkup 6 to 12 weeks after delivery. A fasting blood glucose will be done, and if it is normal, it is advised to continue a healthy lifestyle to prevent diabetes later in life. A small percentage of women continue to remain diabetic and are labeled as type 2 diabetes. There is a risk of the babies being obese and developing diabetes in later life. All women should attend the antenatal clinic regularly when they are diagnosed with gestational diabetes, so that there can be a continuity of care and healthy pregnancy and can have a healthy babies. Gestational diabetes is an important complication in pregnancy. I hope this talk was useful in creating an awareness, and do visit Aster Clinic for your gynecology consult. Thank you.